Hello, I'm Judith Jamieson and I'm an individual and couples therapist and member of staff at Tavistock Relationships. I also deliver training and supervision for the Couple Therapy for Depression project. Couple therapy for depression is a therapy recommended in the NICE guidelines on depression in adults. So it's a treatment for mild to moderate depression in couples where the couple's relationship distress seems to be a factor in one partner's depressive symptoms. What couple therapy for depression does is to improve communication and behaviour, therefore reducing damaging interactions between couples. It changes unhelpful cognitions and perceptions, which help to build emotional closeness and openness. This allows the couple to cope with ordinary and not so ordinary stresses that arise in the course of everyday relating. Couple therapy for depression is unique. It's the only form of couple therapy offered by the NHS. It's a free service, increasingly available either by self-referral or through GPs. But 50% of NHS psychological therapy services don't provide it currently, although the government wants them to. And where it is available, there are very few practitioners on hand to deliver it. The NHS mostly offers individuals CBT or counselling as a default treatment for mental health issues. And assessment staff generally have little or no training to identify whether a relationship is at the root of an individual's depression. But couple therapy for depression is more effective than most of the other therapies available. For example, over half of the people who receive couple therapy for depression recover, which is appreciably more than those who receive cognitive behavioural therapy. Couple therapy for depression can help couples where one or both partners are suffering from mild to moderate depression. It involves an intensive 5 days of face-to-face training, which is a mixture of lecture, role-play and experiential learning. There's a filmed role-play at the end of the week that is assessed. After the course, training cases have to be completed under supervision. Audio tapes of sessions have to be submitted and assessed to allow practitioners to gain accreditation and eligibility to deliver the service to couples in an NHS IAPT service setting. We work hard with therapists and counsellors to help them benefit fully from the training experience. Feedback has been very positive, with many practitioners relishing the chance for reflective practice and group supervision with peers. Training is largely funded by Health Education England and NHS sources, as well as individual LETBs, which vary from region to region. Practitioners need to have access to suitable couple cases in order to qualify, and we do try and help facilitate the process. Supervision is run via the internet using video conferencing in groups of 3 or 4 plus a Tavistock Relationships supervisor. Typically they run fortnightly for an hour to an hour and a half. Group members present casework, reflect on best practice and explore the couple work in relation to the couple therapy for depression model. There are 20 sessions of supervision. Between 3 and 5 audio tapes also need to be submitted to the supervisor, who will provide written feedback. Couple therapy for depression is an integrative training relevant to a broad range of practitioners, including CBT, IPT therapists and relate counsellors. Other practitioners who have trained individually but have an interest in couples work and want to branch out to get some specialist training would also gain a lot from the course. Well, the training is a CPD that can enhance your practice base. It gives you the chance to develop a broader therapeutic repertoire in terms of working with couples. and gives those who are less experienced at working with couples the opportunity of an intensive foundation in understanding how couple relationships affect depression and vice versa. Practitioners get a lot out of the course and find the time for reflecting on casework, new skills and techniques to be both rewarding and enjoyable. To find out more about our training, please see the information here.